Waziri, that you have come to us on this important day is not mambo ambayo tunachukulia kirahisi. As I told you, we really appreciate and we hope you are coming to us today will be the beginning of a great journey as we now highlight the opening or the launching of this facility ili watu wa Garissa, watu wa Northern Kenya region wafaidike zaidi from this important facility. I don't want to make a long speech. All that I want to tell you, Waziri, ni kwamba we are very, very serious on everything, but particularly so on matters health.
Governor, let me first start by congratulating you on your re-election. Getting elected is not easy, and getting re-elected is even much harder. Congratulations, Governor. It gives me great pleasure to join you today to launch Garissa Regional Cancer Center. And this is the first in Northern Kenya region since independence. This is the third such facility that we have unveiled in the country in the last 1 year, which is a significant milestone in the history of our nation. This indeed resonates with the theme for World Cancer Day in closing the gap in the care of cancer. Ladies and gentlemen, NCDs, including cancer, are the leading causes of illness and death globally. This results in estimated 41 million deaths annually, with about 10 million, which is 25%, attributed to cancer alone. The burden of cancer is rising over the past few decades, and it's projected to get even higher, as we were told by our chief, the executive director of this hospital. The most recent data that I have seen in my ministry, it shows that of 7,502 cases that were registered from 42 facilities across the country between July 2021 and June 2022, with most of them being stage 3 and 4. The most prevalent cancers continue to be breast cancer at 15.9%, cervical cancer at 13.3%, and esophageal at 11.8%. Prostate cancer accounts for 1/4 of all cases among our men, with breast and cervical cancer accounting for more than half of the cases among our women. Close to 3/4 of all cases among our women, these are cervical cancer. Here in Garissa, we mostly see cancers of the head and neck, and I am concerned that they presenting very late to our facilities. I know that we can change this experience. And I listened to the CEC for Health on what he did in creating awareness in the local language. I've also listened to the Member of Parliament, and I want to congratulate them and say, let us continue creating our awareness so that our people can get treatment. The heavy impact of cancer on individuals, households, and entire communities through loss of productivity, catastrophic costs of care, premature death is well known to most, if not all of us. Barriers and inequalities that exist include misinformation, stigma, inadequate infrastructure, untrained personnel, and lack of equipment. These have led to unfortunate situation we find ourselves in, whereby most cancer patients, even where they are within the healthcare system, are diagnosed at late stages, resulting in poor treatment outcomes and lower survival rates. But as we stand here today to celebrate, that needs not to be the case, because now we have a facility ambayo itawahudumia ninyi wananchi. Fellow Kenyans, through this launch, minority communities that inhabit this region, who have contributed greatly to our nation through animal husbandry, yet have historically suffered from lack of specialized care access, are poised to greatly benefit from devolved healthcare services. Compounded by perennial droughts as a result of climate change, these communities have traditionally continued to bear the brunt of food insecurity, access to clean water, and other challenges, making access to healthcare such a marriage. Ladies and gentlemen, my ministry has prioritized transformation of the health sector by addressing issues around access, around cost of quality health, and we are going to do this through universal health coverage. The Ministry of Health has put in place the necessary policy framework to achieve progressive realization of the highest attainable standards of health as stipulated by the Constitution of Kenya. We are implementing a national cancer control strategy which has various sustainable programmatic interventions to address the barriers along the entire continuum of cancer care, from screening, diagnosis, surveillance, treatment, and palliative care. Last December, for example, here in Garissa, we trained more than 20 healthcare workers on cervical cancer and breast cancer screening through support from the Global Fund, and also provided pap smear kits for screening. Further to this, the ministry established the regional cancer centers, one which we are launching here today in other places within the country. We have several that were read out to you. We continue to provide with basic chemotherapy medicine through KEMSA, and last month we also came and launched the depot here to take care of your supplies. In addition, the access programs such as Glivec and Herceptin are now providing innovative cancer medicines to our patients with leukemia, breast cancer in our public cancer centers through public-private partnerships. I wish to take this opportunity to appreciate those who have participated in making this possible. Kutoka kwa Rais wa taifa letu, Mheshimiwa William Samoei Ruto. Mumezipokea? Asante sana. Na mimi kama mtu wake wa mkono, aliniambia nikifika hapa niwaambie ile mipango ambayo serikali imeweka kuhakikisha ya kwamba nyinyi wananchi wa Garissa mnapata afya. Hivi karibuni kuanzia mwezi wa 7 tunaenda ku roll out program ambayo kila mwananchi wa Kenya atakuwa enrolled kwa NHIF. Na kupitia kwa hiyo program, ukienda hospitali utapata matibabu bila kutoa pesa yoyote kutoka kwa mfuko yako. Tumepiga hesabu, tumetengeneza essential package na tunajua ni nini ambayo tunastahili kufanya ili kila mwananchi apate afya. Kwa hivyo ni miezi michache tu, kisha kila mwananchi atapata afya. Na mwisho, Governor, mine is to ask you that we work together. This healthcare is devolved. You know very well your roles. I understand my roles, and mine is to request of you as a younger sister, tufanye kazi na watu wa Garissa County waweze kufaidika kutoka kwa serikali hii ya Kenya Kwanza, ambayo ni serikali inadhamini watu wa chini, yani bottom up. Asanteni sana na Mungu awabariki.